Without wasting much time, I'd like to call MaryAnn Gordon, who's a parent of a child with sickle cell disease, to come to the podium and share her story. Thank you. MaryAnn.
I just want to say, though she may look like a vibrant, healthy 8-year-old girl, her struggle is internal. Her physical trauma takes place inside, and every day she has to gather the mental strength and ability and capacity to battle through the most unimaginable pain you can think of. She's my little warrior, my role model, and I'm extremely proud of her resiliency. As a single mother of 2 and a parent of a child with a chronic illness, parenting for me consists sometimes of frustration, hopelessness, fear, sadness, stress, and pain that I just can't prevent the pain and suffering that she feels. In short, I live my life in a constant state of hyper-awareness and anxiety because I never know when she's going to go into crisis. Just a few weeks ago, we went to McDonald's. 1 minute she was eating her McChicken sandwich. The next minute she was having excruciating bone pain in her ribs. I had to call 911. We had to go to the hospital to sick kids because I thought she was having acute chest crisis, which is the most common deadly symptom for those who have sickle cell disease. So thankfully, she wasn't. We were able to go once all her vitals were deemed normal, but this is the life that we live. There is also the tremendous impact that the disease has on her self-esteem. She often complains about being bullied and teased at school because other kids do not understand what it is she's going through. Again, the lack of education and awareness. Among the many hats that I have to wear as her mother, I believe the most important role I have is her advocate. Advocating for my child goes beyond navigating and dealing with those in the medical field and the teachers and staff and friends. There is also the economic toll that is compounded with this. Parents of sickle cell patients miss a lot of time away from their work and are often unable to accept better employment opportunities because much of our time is dedicated to taking care of our children in the hospital. We have to be there to support them sometimes for days or weeks, depending on the length of the crisis they've had. Many are in for blood transfusions, such as my daughter. She's already had her spleen taken out at the age of 4 because of reoccurring buildup in her spleen. I also have to worry about the everyday chance of her getting a sudden fatal stroke, because sickle cell patients have an increased risk of stroke given where an occlusion can happen anywhere in the body. So I joined SCAGO to help me cope with sharing my story with other parents and others, not just parents, but other patients who have the disease. I go to the support meetings whenever I can, and I've come to understand the many challenges and obstacles that sickle cell patients face within Ontario's healthcare system. Suffering pain of extreme intensity is tremendously distressful. The disease itself is difficult enough without having to deal with medical staff who are unfamiliar or uneducated about sickle cell and its symptomology. Because their disease does not necessarily show up on their face, sickle cell patients are often casted into a category of an addict or a hypochondriac. It's, as Larry mentioned before, it's often historically seen as the black disease. Many adult sickle cell patients say they would rather not go to an emergency room and seek attention for fear of being discriminated against. In addition, adult sickle cell patients are often sent home prematurely before their crisis has been properly treated. They speak of the challenge of trying to articulate their pain and suffering to medical staff who are often dismissive and designate their symptoms as not a priority. In an effort to curb the opioid crisis, sickle cell patients are being marginalized, and this must stop. Racial bias within the healthcare system is severely affecting the psychological and physical well-being of adolescent and adult sickle cell patients. There's a serious contrast when it compared to the care that my daughter receives at Sick Kids and in other hospitals across Canada. And I often ask myself, why? Nothing separates my daughter from an adult sickle cell patient except age. Why does empathy and compassion suddenly go away because the person is now 18 years of age or over? As a parent, I am petrified that my daughter will not receive the same care as she gets when she's at Sick Kids and she transitions out. I am extremely grateful to the wonderful doctors and the first-class care that the doctors and the nurses provide there. And I ask, why can there not be a universal standard of care similar to Sick Kids? Who decides what's pressing and what's important? We must challenge and help eradicate these racial biases and stereotypes now. As a parent, I am asking for a better, thorough education for the next generation of doctors and nurses, one that communicates a sense of urgency and understanding needed to treat sickle cell patients like my daughter, Nevaeh. I know I speak for many other parents as well who would like to see greater funding for respite care, especially for those who have more than one child with the disease and are forced to spend immense amounts of time in the hospital with their children. Many would like some aid in education, tutoring in sickle cell children because they are often suffering academically because of the missed classroom time. This in turn affects their future success in post-secondary education and thus employment and career prospects. I will always be a mother of a sickle cell daughter, as there is no cure, but I'm hoping we can work towards making these changes now so my daughter can continue to have the same level of care that when she transitions to other hospitals when the time comes. Further research on sickle cell disease lags behind when compared to others. I just want to say thank you to SCAGO and all the important work that you do to bring sickle cell awareness to the people who are responsible for making these policy decisions, and also to the forefront in general of Canadians. Again, I want to thank the members of the Legislative Assembly for allowing our concerns and that of my daughter, so together we can make a difference.